All right, a lot of people make resolutions to work on themselves with the new year, and fitness may be the main focus for some, but focusing on health is just as important. Joining us is Dr. Constantine George. He is the founder of Vedius App, which I want to talk about briefly in the end. Here to remind us of the annual exams we need to be talking about. There are 10 of them, some for men and women, some for exclusively women and men.
Correct.
Let's go down the list here. Number one we have is for women, pap smears.
Correct. Recommendation is if you're sexually active before 21, get into the gynecologist. Otherwise, starting at the age of 21, get into your gynecologist, get a pap and pelvic done, and then depending on what the results are, the follow-up can be done anywhere from 1 year later up to 3 years later.
Then we have on the list mammograms.
Mammography recommendation is starting at the age of 40 on a yearly to every 2-year basis. Again, depending on what the results are, what your family history is, the doctor will dictate to you how often those have to be done. But starting at the age of 40 is the recommendation.
I have here, and I didn't see it on the list, but the cholesterol checks for both men and women, and it really doesn't matter what your health history is. This is for everyone.
Correct. It depends on who you go through. The United States Preventative Services Task Force has guidelines. Mayo Clinic has their guidelines. What I tell clients, starting at the age of 18, start getting your blood work checked every couple of years to check for cholesterol. Obviously, if you have a family history of high cholesterol, get it done sooner, get it done more often, obviously, as well.
Colorectal exams is also on the list.
Nobody wants to talk about it, but we have got to do them. Colonoscopies, the recommendation is starting at the age of 50, and depending on the results, repeat can be done every 3 to 5 years or up to every decade, depending on what the results are of the exam.
Also prostate screening.
Correct. A little bit controversial. PSA values we've recommended starting at the age of 50, depending on the preventative task force that you look at. It's a little bit controversial. So for that one, I leave it up to the patient to speak to their doctor directly and figure out an as per client basis what to do.
And for women, osteoporosis tests.
Of course, we screen for osteoporosis, low vitamin D. We have one of the highest rates of vitamin D deficiency in Vegas, believe it or not. So osteoporosis screening starting at the age of 65 is the recommendation. And
really briefly, we're talking about diabetes testing, then sexually transmitted diseases, and then blood pressure.
Correct. And all these things, when you go to your doctor's office for your yearly physical, we'll screen you for diabetes, we'll screen you for sexually transmitted diseases. A lot of it depends on your family history and you yourself and what your risk factors are as a patient as well, too.
You mentioned you're the creator of the Vedius App, which I think is fascinating because you're up and down the strip, especially during CES.
Correct. What we've done is we've developed an app, and so it allows patients, when they're here in town, to be seen in the convention center, their hotel room. We actually have doctors that will go there. We can do a telemedicine visit. It's all HIPAA compliant, or we can transport them with sedan service to our concierge practice right off the strip on Flamingo and Durango.
Love it. Brilliant idea.
Good opportunities.
Thanks so much for being here.
Thanks.